Hello everyone, this is Raymond Lee of Raymond's Dental Solution. Today, we are going to talk about the importance of hemostasis and coagulation during dental procedures and why the Yoshida CO2 laser is the ideal tool for achieving these goals. When performing dental procedures, it's essential to stop bleeding quickly and safely to prevent any further complications. One of the many advantages of the Yoshida CO2 laser is its excellent hemostasis and coagulation effect, making it the ideal solution for these situations. For instance, when making a crown, a cord is often placed in the challenge to make an impression, which can lead to bleeding. The Yoshida CO2 laser can quickly stop the bleeding, allowing you to continue with the procedure without any further delay. In contrast, diode lasers have a high penetration rate, making it challenging to achieve surface hemostasis. Although some practitioners claim that diode lasers can stop bleeding, they do so by burning the tissue and covering the bleeding part, which can cause rebleeding and potential complications. Furthermore, the high temperature of diode lasers can damage healthy tissues, leading to long-term complications and adverse effects. In conclusion, the Yoshida CO2 laser is a safe and effective tool for achieving excellent hemostasis and coagulation during dental procedures. With its low penetration rate, you can achieve surface hemostasis without damaging healthy tissues or causing any adverse effect to your patients. Thank you for your watching. Please don't forget to subscribe to our channel for more informative dental content.